Hi, I am Anku Goyal and you're watching Life's True Value, a special series of conversation where we step into the mesmerizing world of business and growth with innovative ideas and explore the true value of return on experience. Return on experience is becoming increasingly important in modern businesses, especially for corporate leaders. While return on investment focuses on the financial returns, ROX emphasizes the value gained from the customer and the employee experiences, both of which play a critical role in the company's long-term success. How do you measure the true return on experience? Join us as we explore these ideas with our special guest, a visionary, a distinguished business leader, and veteran of the education and medical industry. Please welcome the highlight of today's episode, Mr. Gautam Khanna, CEO of PD Hinduja Hospital and Medical Research Center, Mumbai. An alumnus of IIT Kanpur and IIM Calcutta, Mr. Khanna is a seasoned business leader with over 34 years of experience in the healthcare, education, and corporate leadership. Under his guidance, the hospital has earned multiple global and national accolades. Previously, he spent 22 years in 3M, leading its healthcare business in South Asia, collaborating across APAC and Latin America. A key figure in the industry bodies like the Quality Council of India, Association of Hospitals and Nat Health, he has received several prestigious awards, including the Business Leader of the Year in 2024 and Distinguished Service Award for IIT Kanpur in 2023. He has also contributed to various leadership publications and attended a strategic leadership program at INSEAD, Singapore. His career reflects a commitment to excellence, innovation, and transformative leadership in the healthcare sector. To understand the concept of return on experience, today we have a special guest on our show, Mr. Gautam Khanna, who is the CEO of PD Hinduja Hospitals and Medical Research Center. Welcome to the show, Mr. Khanna. It's a pleasure to have you with us. Mr. Khanna, being at the position you are as a successful leader now, for decades you have been in the space, you have always taken high-stake decisions. And as we understand today, the financial investments always come in the spotlight. How important do you think is return on experience as a concept in businesses today?
I think return on experience is a very valuable concept because what happens is the customers, and in our case the patients and the relatives, the value they get out of the experience of visiting a healthcare facility or any other business, which means in terms of their well-being, in terms of their mental satisfaction, in terms of how they are able to be satisfied with the outcome which they get, actually leads to financial outcome for the business. So yes, the financial results are actually dependent on the return on experience. So that I think is a very direct correlation.
Yes, I think nowadays we have started recognizing it more explicitly. Earlier it was always about ROI and not ROX, but today it is more ROX. In your journey, you had a beautiful journey. It's like more than 3 decades, closing to 4 maybe in some years from now. How do you look at your space of, being the chief executive? Do you think that role has been evolving? And how do you look at the position, especially with the healthcare sector?
So I think from the industry and what I have changed, I can say that when I took this role, I was a capitalist. And now after being in healthcare sector, directly dealing with patients and hospitals, I would like to say that I am a compassionate capitalist. And what I think we need to do is the healthcare spaces, the hospitals are today actually treating the sick. So we have facilities to treat the sick.
Yes.
What I would like to do, and I think most CEOs are looking at, is can we transform hospitals into a healthcare space where we actually take care of the community health, and which includes focus on prevention, focus on the general well-being, and the whole ecosystem. And if you are unwell, then you come to the hospital and we'll treat you. So I think it's transitioning, and I'm happy to be trying to be part of it.
It's evolved a lot more.
Yes, it has.
To know it better and more, let me take you around to an open space where we can talk more freely and understand more aspects of the healthcare space and how you particularly look at it.
Absolutely.
Let me lead you there. So, Mr. Khanna, we've stepped out to the outdoor space here. It's all green and, like full of the nature vibe. How are you as a person in your personal life? What do you like more? Nature? How do you make your life stress-free?
I like nature. I like open spaces.
Yeah.
And I try to go for a walk, try and do meditation. I use the gym facilities, etc. So I take care of my
Physical health.
Try to do that.
Yeah.
And of course, I love the greenery. I love the mountains. So I like open spaces.
Now that you've told me that you are so much particular about taking care of your physical health and also mental health, because you're talking about the spiritual practices, how important do you think it is to maintain physical and mental health for your work productivity? Is there a correlation there?
Oh, I think so. I think if the mind is not free, mind is stressed, then the body will not act. So what that means, if the person has mental not issues, but mental problems, then the mind is focused on resolving those problems instead of focusing on the work. And for example, in current environment, in the physical environment, person has to devote 8, 10, 7, whatever number of hours they have to devote. That is actual physical, even if you have to sit, it is a physical activity.
Yes.
So for physical activity to be, you need to be physically fit, and your mind has to tell you that you are okay to sit, because sometimes what may happen is that you are physically there, but mentally not there. So I think both are important.
So it really has a direct correlation with your work productivity.
Absolutely.
We were also talking very briefly about, one is about your stress-free life, I understood, but about your work, your people in the office. Do you also give the same advice to them to keep their balance up there?
Oh, yes. One of the first things I tell people is that you need to take care of the physical health first.
Yes.
And then, of course, you need to take care of mental. So you cannot say that I'm only taking care of my mental health, but physical I will not bother. Because the point is, if you are physically not well, since I'm from healthcare, I'm going to use a thing, that the number of days lost in the country because of health issues, people are physically not well, it costs close to 1% of the economy. So it's a big loss to the country. It's a big loss to people, because if you are physically not okay, you cannot go to work.
Which comes first, mental health or physical? There's this chicken egg theory.
It's like, I'll say this is a circle of life. You cannot say where does the circle start from. So I mean, mental is important, physical is important, yes. Both are important.
Nothing can be said as more important that drives the other one.
The only thing is, people don't understand that there is a mental problem or mental stress they have. They can see the physical injury.
Yes.
They sometimes cannot see the mental injury.
Now we talk about depression and
so it's important actually to recognize that and to address it if possible.
So, Mr. Khanna, now that we were talking about how do you manage to be stress-free and manage all your spiritual and physical and mental well-being together, I also want to understand from you, if you have to say that, what are the two important aspects of the healthcare space where people should focus according to you? Two most important elements if you want to highlight today.
So, I think the two, I would break it up into two parts. So, one is that people need to focus on the preventive health. So they need to focus on doing regular health checkups, need to have adequate diet, exercise, and etc. to ensure that they prevent healthcare diseases from manifesting if they can. However, if even after doing preventive, for some reason, if they have to go to a hospital, the other thing is they need to take care that the costs of healthcare are increasing and will continue to increase for the next few decades. So they need to have adequate insurance. Basically, they need to have the ability to pay for the healthcare expenses, because without having adequate treatment, they won't be
cured.
Yeah, they won't be cured. So I think prevention and having adequate insurance is probably the two messages which I want to tell.
So you think both the sides should be well protected. Either don't go there, and if you've gone there, then you should be able to come out of it in a very protected manner.
And use the best technology. So you use the best resources to cure yourself, which is best technology, best equipment, best facility, etc.
Now to know a little more deeper side of the business aspect of your work, what brings the real stress to you, which I don't think you take very easily. You seem a very stress-free soul. So we will be heading towards the business center. So Mr. Khanna, now that we're in the business center, it really takes me to go a little deeper into your business and understand how you look at the healthcare business. My first understanding from you I want to bring out is we were talking about ROX, return on experience. How do you think that is something that is very important for the patients, and how do you bring that out for your patients particularly when we talk about the return on experience?
So, when the patient comes to a healthcare facility for treatment, what they are looking for is, of course, the treatment of their clinical condition. Plus, they're also looking for things which are not clinical, the experience of the environment, how you deal with the relatives, how they are dealt with in non-clinical situations. So, from the perspective of healthcare, one of the most important things is that the patient needs to have trust in the healthcare facility, in the doctor, and in the healthcare, services. That trust comes when there is experience in terms of either people, whether the doctors and the nurses and the staff is experienced, or in terms of the experience which they get when they visit a facility. So, for example, if you have a doctor who is very experienced and who spends time with the patient explaining things and explaining the pros and cons, then the trust builds up and the patient believes the healthcare facility. And once they go out, they see if it is a seamless experience they have. They are not bothered by other things. They are just come for a clinical treatment. They do that and leave without any hassles of, for example, standing in queues to pay bills, somebody bothering them, the noise element, the environment in which they are sitting, the furniture, the room, and the overall decor of the place, how the relatives are treated, how they are treated. So, all this adds up to the experience. So, I think the way we are going, the health sector is evolving. Earlier, we were in just from a single clinic point of view where there was a doctor and there was a prescription and treatment done. Now we are moving to a facility where the patients are looking for a overall experience adding to their healthcare outcomes. So I think it really is important, and all of us, including us at the Hinduja Hospital, are trying to improve that.
When we talk about return on experience for patients, it is really important, as you elaborately explained us about it. But if we talk about return on experience for your own people, the people working with your team, the Hinduja group, how do you have to ascertain they also have the similar kind of ROX experience while working, and how does it transcend to the patient as well?
One of the things we have to think about in a healthcare setting is all the people who work in healthcare, they are all committed to actually delivering good healthcare outcomes to the patient.
Okay.
So they have the passion, they do that for the passion. So we have to ensure that if the employees, our people who work for us, if they are satisfied and happy, they will ensure that the patient is taken care of. So for good patient care, I need to take care of the employees. For employees, we think about it in aspects of, let's say, physical, mental, emotional, and spiritual. You can take care of all
aspects.
So physical is pretty simple, that you give them all the physical facilities to work properly, appropriate seating spaces, appropriate equipment,
good infrastructure,
etc. Yeah, good infrastructure, and a pleasant workplace to work on. I mean, it's not something which was designed in 1950s. You have to be with modern times and appropriate ergonomic seating, etc., etc. So that physical is very important. Then you need to take care of the emotional health, because see, every day when the patients are coming to the hospital, they are in stress, their family is in stress, and they are transferring their stress to the employees. So employees have to be taken care of at the emotional level. So that means we manage their emotional health through some kind of HR initiatives. I'll talk about that in a minute. And then mental means that if they have emotional problems, then it should not translate to mental problems.
Peace of mind goes
up. Peace of mind. So, like, for example, we have organized a program, developed a program during COVID called Sampark.
Okay.
So where we deal with all these aspects: physical, mental, emotional, and spiritual. Physical, I talked about. You can do simple thing like a walkathon or some events or something along with the infrastructure.
Physically engaged with.
And you connect them together and you have some events. Then emotional, you make them do things together, some team sports and bonding, etc. And some R&R you do.
Yes.
For mental, you do something like a quizzes or some IQ type of things, and then also you give them access to psychiatrists if they have a mental issue, anonymous. It's free of charge. They can call 24/7, any of them. And for spiritual, what we do is we have meditations every week.
Wow.
Organized in the hospital, and people, employees and patients are free to attend. So, when you do all this, there is a sense of belongingness which the employees get to the organization. And they know that the organization is taking care of them. And then they in turn take care of that. And I can go on and on, but for example, we recently organized our annual day.
Okay.
So where we invite the employees and the families. And you're talking about, we have 4,000 employees. So you can understand.
At least double the number.
Double the number.
Yes.
So that, and they have events. So, that's kind of a bonding kind of thing. Then we do with doctors, things like that. We do some outbound activities. So I think there's a lot of work to be done to ensure that the clinical outcome is okay.
No doubt. After listening all this, I am feeling so satisfied. It is so interesting to work with a group like this, which is not just taking care of your employees, but training them in a very subtle way, making them feel a part of family, whether patient or your workers all are same family. Now, to do all this, which you have told me right now, to take care of the patients, their experience, worker satisfaction, a lot of technology has now come handy.
Yes.
We are in a complete turnaround world. We have been with technology for a while, but when we talk about artificial intelligence, we try to just advance it to a next level. So how much that, because in the digital space of healthcare, which we already stepped in, how much do you think AI has just fast forwarded it, or it is good or bad? What is your take on it?
So, Ankur, let me just take 2 points from what you said, digital and AI. So I'm just going to give it separately. So hospitals and healthcare have adopted digital very well.
Okay.
In the sense, what used to be earlier that patients had to stand in queues to get their reports, investigation reports, now it's available online, and you can see whether lab reports, and like for example, we do even radiology. You can get your MRI and X-ray, etc., everything on email. So that is a easy thing. Digitization, you can get appointments online, you can pay online. So I remember 10 years ago when we implemented this, there was a little bit of challenge when the mandate we gave to the team is that the patient should not come and stand in queue to pay. They should do it at home, print their voucher at home, and come straight to the doctor room. So, that
a lot of tasks is taken
care of, and then it reduces the crowding. So the crowding is reduced, and you do things like that. And then you have the digital initiatives, like for example, if a patient is getting admitted today, they have the anxiety. When should I go? What will happen? So we send a message in advance, 24 hours before, saying that this is what is going to happen when you get admitted. This is the checklist. This is what you need to get with you. This is what will happen to you. And you ensure that you come these are the following steps you need to take. And while they are inside, admitted, you send them a message that this is your bill. So don't worry, there is anxiety. How much is my bill? What should I do? When they are being discharged, after they are discharged, you talk to them and you take feedback. So this digital journey has evolved. So many hospitals are doing that. So that's the digital part of it, where we are talking about easing the logistics and the conveniences, etc., etc. So about AI has mostly currently come in the radiology space. And AI is now, what AI is doing is, it is helping the clinicians to do their work faster.
Yes.
Also helping the clinicians to make the clinical decisions faster. The other places where AI is developing, and for example, what we have deployed is remote monitoring of patients.
Okay.
So we are doing currently in the wards. To give you an example, in a ward, there is a nursing station and there are multiple, maybe 14, 15 patients. And it's very difficult for a nurse to monitor each patient going to every room, very frequently. So what happens is in ward, patients are okay. They don't need ICU. But something can happen. So what we have done is we have installed an AI-enabled remote monitoring thing. So the patient is in the bed, they're lying down, nothing but that is coming on a screen on the nurse's station. And nurse is just monitoring. If there is a blip, then she goes. I mean, apart from
it's like the vitals can be immediately tracked on the screen. Yeah.
And so one of the things is that, let's say, for example, every 1 hour, anyway, she has to go.
Yes.
But if there is something wrong, she will go in 15 minutes.
Wow.
And to give you an example, in the last 6 months or so, I mean, we monitored hundreds of patients, but we caught 3 patients whom we protected because they
save more lives.
Saved lives. So it's like 3, the DP fell, and if nobody would have known. So she went and checked, and immediately the action was taken. So that AI is helping. AI is also helping sometimes in developing the diagnosis in non-radiology area where there are multiple parameters to be seen. For example, in a patient where it will analyze the history of the patient. Suppose we have the records, it analyzes the history, it gives a pattern and says that based on the last 20 years history, these are the things you need to look for. So the clinician is able to do faster.
Less errors, a comprehensive understanding of things, so adds a better result to how you look forward.
Yeah, so I think it's developing. So it's a question of time. But if some people believe that tomorrow AI is going to replace the consultants and doctors, I don't think that's going to happen.
Sure.
The consultants will be aided by AI.
So it is a catalyst, and it is so comprehensively how you have put things in place so that we don't get confused and AI will replace or something like that. And we know that you've always supported innovation and technology. So this is the space for you now, where you have been leading it for at least the Hinduja hospitals. Thank you so much, Mr. Khanna, for your time, for making us understand the importance of ROX and also how we have to understand it deeply and not just use it as a say of just an experience for patients, but also your people. Thank you so much. It was a real pleasure having you on us.
Pleasure. Thank you.
As we wrap up this episode, I extend my heartfelt gratitude to Mr. Gautam Khanna for sharing his invaluable insights and making this conversation truly enriching. It is time for me to sign off from 25 South, one of India's most luxurious residential places and an oasis of elegance and opulence. We'll come back soon with another interesting episode. Till then, stay positive, stay unstoppable.